Hey, this is Brandon with ChiroUp. I want to go over a piece of the blog in video format because I think this is pretty important. One, because it hones in on some evidence-based recommendations and techniques, but also includes some evidence-informed things on things that I do in my practice. So first off, as far as the number one complaint that we're going to see in our office across the board, not necessarily your practice or my practice, but most chiropractors, it's sciatica and it's nerve pain. And we have to remember that nerve pain isn't always a problem with the nerve. Sometimes it could be the nerve is a primary source of pain, and other times it's due to the structures around it that lead to compression or irritation of that actual nerve. So it's our job through orthopedic diagnosis to make sure we know where the source of pain is coming from, and then we also know what structures affect that. But that's not the purpose of this blog. The purpose of this blog is to get people out of pain. And especially when it comes to sciatica, there are a couple proven methods to make this happen. We have nerve flossing. If you haven't seen nerve flossing, here's a great example right here. This is a technique that we use in our practice to help stretch or tension the sciatic nerve with using head movements that you can actually, as a practitioner, lead this in your office and get that nerve to desensitize and make it feel better, decrease pain, decrease inflammation. Works great in my practice. I use this for a lot of my patients when applicable. We can also use spinal manipulation. Clearly one of the number one things that we use as chiropractors. Some people are not going to be able to tolerate that quite as well. So in my practice, one thing that I'll somewhat start with, especially on those hot backs that don't really want me jumping on them as far as a diversified manipulation, I'm going to go ahead and do mobilization. Here's an example of what I do as far as mobilization. It works really well when I throw in a contract relax at the end of it. So I'm going to mobilize the actual lumbar spine. And when you can do that, you can open up the actual intervertebral foramen. You can stretch slowly that sciatic nerve through that intervertebral foramen by creating some distraction via hip flexion. And in fact, one of the things that I use, and I want to throw another shout out to Dynamic Disc Designs, is to show your patients what you're doing. And you can actually demonstrate with your patients. Here you go. When you're rotating like that, you're actually opening up that intervertebral foramen, and they can see what you're trying to do. So creating some tension and compression on that spinous process can help open up that intervertebral foramen, and your patients can actually see that with models like the ones from Dynamic Disc Design. So something that I use for my patient education all the time, and especially what I want to talk about today is something that I've never done in practice. Not that I haven't thought of it. I just never seen it in the research, but it turns out this is all over the research when it comes to Mulligan mobilization, and it's Mulligan mobilization with leg movement. You can see papers back as far as 2012 and 14 with similar movements. However, one just came out in Archives of Physical Medicine showing that if you can perform spinal mobilization with leg movement, you can see decreases in VAS, decreases in pain, improvements in SLR, improvement in patient range of motion, and you can see it both in the short term and the long term. And that's huge. There's tons of patients who want to get out of pain now, but they also want to stay out of pain. So here's an example of that. Here you can see with my patient is that I'm putting pressure down on L5, and I can start at L5 and move up to L3 and L4 if I'm not getting the symptom response. But what I'm doing is I'm creating some medial pressure there, see if I can open up that intervertebral foramen. And when I can do that, I'm actually taking this patient through an SLR passively. You can do it actively, but passively, you can take away the muscle guarding. And now I'm going to see if I can improve their SLR through that medial compression to that spinous process. If I can do that, if I can improve that range of motion, then I'm going to go ahead and do maybe 3 to 4 sets of 10 repetitions to help open up that space, promote some nerve sliding, and hopefully take away some of their pain. Now, if I can do that at those levels, L5, L4, L3, and they can get some symptom relief, then guess what I'm going to send them home with would be a sciatic nerve floss from a side lying position. This can be done on the side of a couch. I'd actually prefer it more on a firm bed would be better, just to avoid the lateral flexion you get out of a saggy couch. However, you can marry your treatment to an at-home exercise and give these patients some long-lasting results. So just my piece of advice, I think mobilization is great. Believe me, as a chiropractor, I love hearing pops and cracks. I love manipulation. It gets people in and out of pain quickly. There is a subset of the population that does not like to get their back cracked at the very beginning. So this is a quick way of getting them in those positions and hopefully providing some symptomatic relief to a very detrimental condition when they're having sciatica, pain, numbness, tingling going down the leg. So something to consider, something to add to your toolbox. I hope this helps. If you have any questions, give me an email at brandon@chiroup.com, and I hope to hopefully add something useful to your practice, and most importantly, add some value to your patients.